Hi class, I wanted to give a little mini lecture on issues of factors and levels when you are working with Factorial, ANOVA, and ANCOVA. I get a lot of questions and mistakes around this issue, so I wanted to give a little bit of attention to it. So let me give you an exemplar here. This is a study of a 2x4 ANOVA. In this 2x4 ANOVA, one of the independent variables is gender, just in two groups, male, female, and the other is 4 types of medicine administered, either no medicine, a placebo, some homeopathic medication, or a pharmaceutical. And then they measured people on the Beck Depression Inventory scale to see if they had differences. And you can kind of see there the scores, right? So you get a little crossover there where females have lower scores on pharmaceutical than males do, but females have a little higher score on homeopathic than males do in this. And then it looks like placebo and none don't really have a difference. So you get a sense there of the data. There may be a little bit of a difference there, but when you compare homeopathic and pharmaceutical, as we just kind of look it over. But what I want you to be thinking about is, what are the independent variables here? Right, we have 2 independent variables. They are gender and medicine. But it's a 2x4. So think about when you have like 2x4 ANOVA, you have 2 numbers there, which means there's 2 factors, or there's 2 independent variables. One has 2, right? So here's my arm with 1, and the other one has 4. Here's my arm with the other, right? So it's a 2x4, but there's 2 hands, right? So 2x4. Trying to get this on the screen. It's going backwards on my screen. 2x4, right? If I have 2 hands, then I have 2 independent variables, each with levels. This has 2 levels. This has 4 levels. 2 levels, 4 levels. Right? So I think it's really important to make sure that you keep straight how many independent variables do I have, and then each one of them has their own levels. Okay. So walking it through, one of the things you're going to be thinking through as you think through a factorial ANOVA is, what are the tests that I'm actually running here, right? And a remembrance that an independent variable, or an IV, is also called a factor in some places, particularly within SPSS, it calls it a factor. So I want to make sure you stay clear on that. And if you're doing a factorial ANOVA, in the example I gave, then you have the main effects of gender that you're going to need to test, and there'll be an F test for that. The main effects of medicine, and there'll be an F test for that, and the interaction of the independent variables gender by medicine, right? Because you had 2, right? You could have 2, so there's gender, there's medicine, and then there's the interaction of them together. So if that helps you remember, gender, 1 independent variable, 2 levels, medicine, 2nd independent variable, 2 levels, and their interaction with each other. The levels are really important to remember. So in this one, we have male and female for gender, and we have non-placebo, homeopathic, and pharmaceutical for medicine. And then we actually have 8 levels for the interaction. So taking it to the next level here. We have males who get no medicine, females who get no medicine, males who get placebo, females who get placebo, right? And what's going to happen is every participant is going to be one of those 8 categories. And you can look at it just by gender, ignoring medicine, and you can look at just medicine, ignoring gender, or you can look at the interaction of them, 2x4, and that gives me 8 different groups that I would have to compare to see if where there's differences here. This has to do with the opening and closing of doors. It's where it gets complex. So if we're looking at an interaction F test, right? And then a main effects, and so 2 main effects, one for one IV, one for the other, for gender and medicine. So if you're looking at your output, or you're having it explained to you in a conceptual question, and say, hey, I have the interaction F test is significant, gender by medicine. Then what you need to do is, that door is open and you keep going and examine the simple effects of those 8 groups, right? We had the 8 groups here, so you're going to have to look at the simple effects of the 8 groups. If you have a main effects of gender, well, that's only 2 groups, right? So since there's only 2 groups, then you're just going to compare them and see which one's higher and lower. Right? If you had a significant main effects of the 4 medicine groups, now you're going to have to do some kind of post hoc pairwise comparison for the 4 groups because you don't know where the differences lie there. All right. If, however, the interaction F-test had not been significant, stop. You don't report the simple effects of those 8 groups, right? Even though you may have it in your output. If the main effects of gender F-test is not significant for the 2 groups, stop. You don't report those as significantly different. Now, you may just report them as descriptive data. Here's all my mean scores. But you would never say that's a significant difference. And you don't say one's higher than the other. Even if the numbers are not the exact same number, if one's a little higher, if they're not significantly different, then you don't say they're different. All right? You want to be clear in your communication. And then finally, when you have the 4 groups, if you have the 4 groups and they're not significant at the F-test, then you stop. Don't report the post hoc pairwise comparisons there either. Okay? And finally, making sure that we're keeping it all straight. Remember that each independent variable has 2 or more levels. Could be 2, could be 3, could be 4, could be 5, whatever, right? The levels are the groups, right? Each group, however many you have. The independent variable is like your arm. It's like, the construct that you're trying to measure, the factor that you're trying to measure, right? So I'm going to give you a few examples here. A factorial ANOVA or ANCOVA can have 2 or more independent variables. So 2 arms, 2 by 4, something like that. So if I have a 2 by 2, then I've got one that is just therapy, right? Here's my therapy, and it's yes, no, they got therapy or they didn't. Then my other one, drugs, yes, no, they got it or they didn't. And then the interaction, right? And you'll have people who got therapy and got drugs. People who got therapy and didn't get drugs. People who didn't get therapy and got drugs. People who didn't get therapy and didn't get drugs, right? You have four of them. A 2 by 4 would be like the one we just did, gender by medicine, right? And the levels there, you have the main effect levels for gender, main effect levels for medicine, and the main effect levels for the interaction of them, of a 2 by 4. And finally, you can also, don't forget, have a 3-way ANOVA where you have to have 3 arms now. 1, 2, 3 arms. And you'd have 2, right, for therapy, let's say, yes, no. And then a second one, drugs, yes, no. And let's say a third arm for the season when people started treatment, summer, winter, and fall, let's say, in this study, right, in the 3 levels. So for this, you have the main effects of therapy, the main effects of drugs, and the main effects of season. And then you have the interaction of therapy by drugs, the interaction of therapy by season, and the interaction of drugs by season, and the interaction of therapy by drugs by season, the 3-way interaction. So you have 2-way interactions, 3-way interactions. And you have a lot of levels at all of those. So at the 2 by 2 level, you'd have 4 to look at. If it's a 2 by 3, you'd have 6 to look at. And if it is a 2 by 2 by 3, you have 12 groups to look at, right? 2 by 2 is 4, 4 times 3 is 12. 12 groups for the 2 by 2 by 3, 3-way interaction groups. That's 12 levels to look at, right? So I just want to make sure you stay clear on the difference between independent variables and levels, particularly as you start looking at interaction effects. Hope this is helpful to you.